But of course, coronavirus remains the big story of the day. And earlier on, we heard Rishi Sunak saying that the government will provide extra support for the NHS and business to deal with the impact of the outbreak if needed. Well, to discuss that further, we're joined now by the Chair of the Royal College of GPs, Professor Martin Marshall. Thank you very much for being with us.
Good morning.
Today. We heard earlier from Rishi Sunak talking about more money for the NHS, if necessary, in the budget. Does the health service need more resources to tackle coronavirus?
Yes, it almost certainly does. This is a significant crisis for the health service. Health service is already under pressure, as we know. If we're going to try to continue doing what we are doing in the health service and deal with coronavirus, it requires a significant amount of resource. More likely, I suspect, we will cut down on some of the routine work that's done by the health service in order to allow the NHS to focus on dealing with the coronavirus.
I mean, routine work, are we talking there about non-emergency operations being cancelled, that kind of thing?
I think that's likely. We don't know yet. We're not certain, but I think it's likely. So the kind of routine operations, hip replacements, knee replacements, hernias, endoscopies, those kind of things where you're not worried about cancer, relatively routine. Clearly a great inconvenience for patients, but not life or death.
We're talking there about the resources of the NHS. You were saying how the NHS is already quite stretched, and certainly we've got record waiting times at A&E. We've seen lots of people on long waiting lists for operations as well. Is the health service prepared to deal with this kind of emergency situation?
I think it is. I mean, it's difficult because we don't know what the scale of the emergency will be. At the moment, some of the figures that we're seeing are the worst possible scenario, and I think we're right to plan for those. The NHS is very good at dealing with crises like this, and it's proved that time and time again in the past. It doesn't mean that there's no implications, as we say, for routine procedures, for example, but the NHS is well-resourced, it has really good planning mechanisms, and we know how to deal with these kind of crises.
You were talking there about some of the worst-case scenario numbers being floated around. The Sunday Times reporting today ministers are working from what they describe as a central estimate of 100,000 deaths from coronavirus. I mean, does that sound realistic?
It's very difficult to tell. We know that around about 17,000 patients a year die of flu, so we know that these kind of viruses can be very serious. 100,000 is probably more like a worst-case scenario, I suspect. It depends on whether we manage to continue to contain the virus in the way that we are doing. At the moment, it looks like the numbers are going up, and they'll probably continue doing so. It does look like we need to shift from a contain phase to a more of a delay phase, which has a number of advantages. We just don't know how it's going to play out.
It's difficult, isn't it? And there's been lots of speculation about social distancing, cancelling big meetings, big concerts, or playing football behind closed doors. Is that kind of preparation effective?
Yes, it is. Yes, it is. We know this is an infectious disease, which is transmitted mostly through droplet infections, so coughing, sneezing, and when the products of cough or sneeze get onto hands or onto hard objects, then it transmits that way. So we know that maintaining social distance, keeping people apart from large events, for example, or even from workplaces, more people working from home, for example, is highly effective. And in many ways, this is basic hygiene. This is about hand washing. It's about keeping people apart and stopping the spreading. I'm
interested to know a little bit about the impact on GPs as well. There's been talk about asking retired GPs to come back and help out effectively. If it does become more serious. I mean, do you think that is a good idea? At the same time, I guess that many of these GPs could be in the at-risk age category themselves.
I think it is a good idea as long as we do it carefully. People are estimating that maybe 20% of the workforce might be out of action at any one time when the crisis reaches its peak. People are talking about maybe sometime in April, late April for that. If that happens, then we do need to expand the workforce in whatever way we can. The suggestions at the moment from the Chief Medical Officer are that people who are within a couple of years of retirement, so they still might have their registration, could be quickly get back onto the medical register and would be able to practice. Most likely those doctors, because as you say, they would be likely to be in the higher risk group, would not do face-to-face patient contact. But there's lots of other things that they can do, managing 111, providing online care, for example, or telephone-based care for patients.
And do you think GPs will listen to the call? Retired GPs, or do you think they'll be reluctant to, come back into work?
I'd be confident that they'd respond positively. I think that's what doctors are trained for. Doctors tend to respond very positively when in states of emergency.
We've also seen GP surgeries closing, even if temporarily, if it's found that someone who's been into contact with a surgery has tested positive for coronavirus. Is that best practice, or is there a worry that if GP surgery starts closing, then it could have a big impact for health provision?
Well, it's a difficult balance, isn't it? And in each of these cases, there's no absolute answer. So on one side, if we know that somebody has maybe infected a building or infected staff within a building, it makes sense to isolate that building. On the other side, if that then results in no one in a local community getting care, then that's a problem. So there's always a delicate balance between overreacting and underreacting to these problems. At the moment, we're still at the phase where if it looks like somebody has infected in an enclosed area, then you should isolate that area, you should shut it down. Whether that will still be the case in a few weeks' time, I think it's difficult to tell.
Yeah, as you say, always responding to the most up-to-date advice and situation. On that, how do you think the government has been handling the situation so far?
I think well. I think it's clearly a difficult situation. We know that this is an emergency. We know it's going to get worse than it is now. The job of government is to plan for the worst scenario, but also to reassure the community, people as best they can at the same time. I think they're doing pretty well. It's very easy to pick out areas where things haven't got exactly right, where maybe advice has been contradictory.
Is there anything particular that you'd say? Or?
Yeah, no, not particularly. I mean, there's no specific cases, sometimes where one part of government is saying one thing and another part of government is saying another thing. I think that's probably inevitable at a time when we're learning rapidly and the situation is moving rapidly.
Yeah.
Overall, I think that government is probably doing a pretty good job in this country, and that's one of the reasons why we've got only just over 200 cases in comparison with other countries that have got far more.
Thank you very much for coming on the programme and giving your view on where we are with coronavirus. Much appreciated.
Thank you.